Okay, so this lab is going to be the sit and reach assessment. Okay, so how we do the sit and reach is you want to first have your client or patient up against the wall. And you're going to do 3 points of contact. We need her head in contact with the wall, her shoulders, and her hips. So we have 3 points of contact. She's going to put both her hands, fingertips together out front. We have this slide rule right here. So we need to make sure that this slide rule is right up against her fingertips, which is right about there. Now, once we have that set up, she's going to do 2 short attempts into a fully extended attempt, reaching out as far as she can. Okay? Now you want to make sure that you hold the apparatus and hold the slide bar. Okay, so go ahead and push on the tool. 1, 2, and now push as far as you can. Okay, so when we read our measurements, we want to read on the left side of the bar. And we have inches and we have centimeters. So scale B is inches, scale A is centimeters. So we're going to measure in inches, and you want to just round to the nearest line, which is 20. So she is a sit and reach flexibility of 20 inches. Okay, so today's lab is goniometry measurements. Okay, this is a little bit different and a little bit higher standard than your sit and reach. Goniometry measurements actually measures the range of motion at a specific joint. So in your lab, you're going to have to do various joints. Today we're going to do what's called the acetabular-femoral joint or the hip joint. And we're going to do 2 measurements. One passively, where I move them and they hold, and 2 active. Okay? Now when we're looking at hip flexion, which is what we're assessing today, we can either do hip flexion with their knee bent, or we can do hip flexion with their knee straight, okay, which is coming up. So hip flexion with knee bent takes out the hamstring, so we get more of an assessment of the glute max, the glute min, the glute med, and the musculature on the posterior aspect. When we have it with their knee straight, we're assessing more hamstrings. So to begin, we have our goniometer here, and you have 2 sides of the goniometer. We have the stabilizing arm and the measuring arm. The measuring arm is the arm that moves. So when we're looking at hip, acetabular-femoral, straight leg raise, or hip flexion with knee bent, we want to locate the greater trochanter. So the way we locate the greater trochanter is we palpate here, and I have her greater trochanter. The greater trochanter is a part of the femur bone. So I take my access here and I place it on the greater trochanter. My stabilizing arm goes up to mid-axillary, and my movement arm is going to follow along her mid-femur or mid-thigh and point down to what's called the femoral condyle. Okay? So I'm going to do passive first, and then we'll go into active. Okay, so when we're assessing passive range of motion with the goniometer and looking at hip flexion with knee bents, what we want to do is take our hand, place it directly over the ASIS, which is called the anterior superior iliac spine. It's part of the ilium. And then we're going to take our other hand and place it directly underneath the knee. Now we want to lift her leg up till we feel a posterior pelvic tilt, meaning the pelvis shifts back that way. So once we feel that posterior pelvic tilt, which is right there, that is her maximum hip flexion with knee bend. So go ahead and hold that right there, Natasha. Thank you. And we take our goniometer measurement. We feel for the greater trochanter, which is right there. So our access goes on the greater trochanter. Our stabilizing arm goes mid-axillary. And then we move our moment arm to point at the femoral condyle. And then we get our measurements. And she is at roughly 120 degrees of hip flexion. When we do straight leg raise passive, we keep her knee straight, same hand goes over the ASIS, and we lift straight up, feeling for that posterior pelvic tilt, keeping her knee locked out. And she's at about right there. So then I'm going to ask her to go ahead and hold that. Good. I take my stabilizing arm, find the greater trochanter. It's right here. Stabilizing arm goes up to mid-axillary. Movement arm comes up, points up to the femoral condyle. And we are the same, 120 degrees of hip flexion, straight leg raise. Usually, straight leg raise with knee straight is less than knee bent. Natasha has great flexibility, so she is the same.